This is Jason Sorg for Health Assessment. We're going to be studying the neurological system evaluation and the evaluation of the musculoskeletal system. I have with me my mom. She is going to be representing the client patient. To begin with, when you're doing the assessment, the initial phase is inspection. You'd be inspecting to see how their posture is. Do they stand erect with their hands by their side and the feet side by side? Do they stand or do they sway a little bit? Watch their gait. Is the gait steady or unstable? Another thing you want to do is when you're speaking with them, listen to how they talk. Are they speaking clearly? Are they speaking with a slurred speech? Are they alert to their surroundings? Or do they have periods of confusion? Do they have headaches? Any discomfort that would be a red alert that something is going on with their neurological system? Furthermore, discomfort in any certain area of the body, which shows that there would be a problem with the musculoskeletal system. To begin with, upon inspection then, what you want to do, as I said, is perform a mental health evaluation. You'd be asking them questions which would indicate whether they are alert and oriented, times the three spheres, place, person, and time. In continuation then, we would assess the cranial nerves, the neurological system, deep tendon reflexes, and we will proceed on with the musculoskeletal. With each nursing skill, a person would be able to combine this technique just pretty well. It is an individual skill of how you would manipulate it in your examination. With the neurological system, you're going to be assessing the 12 cranial nerves. I, unfortunately, at this point do not have everything that you would need, but when you're assessing, the cranial nerve 1 is the olfactory, and it's the sense of smell. You would have a vial. The vial would have upon it a label which indicate what the aroma is. You would have a card there that would have a list of the aromas. Mom would close her eyes, close the nostril. She would inhale with one there. Then what she would do is point to that card. What did she smell? We would use another vial. She would close her eyes, occlude the other nostril, and then smell, and then point to the card again. This would indicate whether there is any damage to cranial nerve 1. Cranial nerve 2 is optic, and most of the time you would assess with the Snellen's test, which you normally see on an initial eye exam, to assess 20/20 vision. Cranial nerve 3, which is the ocular motor, is pretty well about side gazing, her peripheral vision. And as in another examination, what we have done is you would use a card for one eye, have, for example, with these two cards, I'm going to have Mom hold this card on her right eye. I'm going to cover my eye, and what I'm going to do is I'm going to ask her to tell me, just to see, looking straight at me, when she sees my hand.
Now.
Okay. And then if you would cover the other eye, the same thing.
Now.
Okay. And basically what you're doing, you're assessing the peripheral vision. Cranial nerve 4, which is the trochlear, is the eyelids. I'm looking to see, are the eyelids drooping? And of course I don't. Tracheal nerve 5, trigeminal, this is mainly your forehead, your cheeks, your chin, your sensations. I'm going to have Mom close her eyes, and basically what I'm going to do, touch her rapidly on her cheeks or forehead. Tell me when, just say when you feel anything.
When.
Okay. I moved her hair, but that's okay.
When.
Okay. Basically, what you're doing is you're checking to see about the sensation. Another thing, you're checking the jaw. I want you to clench your teeth, and what I want to do is I want to see, kind of move your jaw with a little bit of force, like you're trying to open your jaw. Okay. Now another thing, what you can do, you can combine the musculoskeletal technique, checking the TMJ, the temporomandibular joint. Open up your jaw for me, and you're feeling the space right here. There should be a slight space between. And what you're wanting to do, you're wanting to see, is it symmetrical or not? Alright? And it feels pretty good. Another thing I want you to do is open your jaw and kind of move it side to side. Alright? And just kind of protrude it a little bit. Okay. That is a good handy-dandy thing to check to see your TMJ and also cranial nerve 5. Cranial nerve 6 is the abducens, and what that's referring to is how your pupils react. And as a previous exam, you would dim the lights. What I would do, I would just flash a light. I could check to see, and the pupils are responding. You would want to see, are they responding equally with accommodation. I would also have Mom to follow my finger, keeping your head stationary, checking the 6 cardinal points of eye movement. Proceeding on with cranial nerve 7, which is the facial. I would have Mom do some facial expressions. For one, just smile. Another thing, kind of puff your cheeks. Another thing, what I would want you to do is kind of raise your eyebrows. Kind of like your where your forehead would wrinkle. Squint a little bit for me. Okay. Now, another thing what we're dealing with here is it deals with the anterior 2/3 of the tongue on the about the taste and everything. And what you're getting is whether you have a sweet taste bud or a sour taste bud. That's where the taste buds are. What you would do, you would take something that's got sweetness to it. I would have her open her tongue. I don't have one on me at this time. I'd have her stick her tongue out. I would touch that part of the tongue, and she would tell me whether she tastes or not. The same thing with the sour. Cranial nerve 8 is auditory. Now, a lot of times you would have equipment that would assess the hearing. Another technique is the whisper technique. Like if I say the word puppy. Do you hear that?
Mm-hmm.
Okay. Okay. Mm-hmm. Basically what you're doing is you're taking into evaluation, do they hear whispers or stuff? Is there equilibrium there? Alright, proceeding on with cranial nerve 9, the glossopharyngeal. You're checking the gag reflex, and you're checking now the posterior 1/3 of the tongue, which is dealing with bitter or sweet taste. Basically, with that, like I said, with the previous taste buds, you would be using something with a bitter taste or a sweet taste to that tongue, and she would be responding. I would have her open her mouth. I don't have a tongue blade with me, but just to show you, I would tell her, this is what we're going to be doing. I'm going to be eliciting it. I would be looking back at the uvula. I'd have her say ah, and I would elicit the gag reflex, and I would notice the soft palate in the back about the reaction. This is also in response to the vagus nerve also. Usually the vagus nerve, another thing is the swallowing technique. Go ahead and swallow, and you just don't want to see them swallow. You want to see, is it symmetrical? Is it leaning to the side? For example, a stroke victim, the way they might swallow, you might see more of it towards the right lateral than the left. So you need to look, take into consideration that. Cranial nerve 11, spinal accessory. This is neck movements and stuff. What I want you to do, and this is good also for your musculoskeletal. I want you to move your neck back and forth and side to side. You're also checking, ironically, your vertebral spine at that time. So that helps very good. Shrug your shoulders. Now, I'll tell you what I'm going to do. I'm going to try to press down, keep your shoulders shrugged. Okay, you're checking also strength, so you're combining both of that. Finally, cranial nerve 12, hypoglossal, is tongue movement. Now, what you want to do, Mom, stick your tongue out. What I'm doing is, and I'm going to use a pen light, you just go ahead and stick it all the way out, and I'm looking at the symmetry. How's the tongue positioned? Is it positioned right? What I want you to do is, I want you to stick your tongue out, move it side to side, and move it up like you're pointing it towards your nose and down. Okay, now, what I want you to do is close your mouth. This is the technique used to check the strength of the tongue. I want you to move your tongue towards here, and I'm just feeling, and right over here too, seeing how the tongue is. Is the tongue strong, or is there anything going on? Another thing I do want to add is when she stuck her tongue out, does the tongue quiver? Are there any tremors going on that we need to take into consideration? Another thing I want to do is we're checking, like I said before, about gait. Okay, what you want to do at times with the gait, you want to do what's called the heel toe, where it goes side, where it's kind of like I consider a marching. You're putting that heel next to the toe and back. Alright, Mom, if you will, if you'll just stand and just do 3 steps for me. Heel next to the toe. One more time. Okay, you may sit down. Basically, what you want to do, if there is any problem in the neurological system, they're not going to be able to exactly do that correctly. Another technique is hopping on one leg, which also helps your equilibrium. Mom, if you'll do that, hop with one leg, just, okay. And do it again with the other, okay. Alright, now, if there's any problems or anything like you would see with any neurological disorders, you would see definitely a problem with them hopping and everything, with them trying to ambulate. Another thing that I want to do is now, is we're going to be assessing other things in regard to the neurological system. And I'm going to grab an object. Mom, if you'll close your eyes. With this object, we're going to see if she can exactly tell me what this is with her right hand. Okay, just feel of it. With
money.
With your one hand.
Oh, sorry about that. Money.
Okay, what is that? Is that
a quarter? A coin?
Okay, a coin. Right, with the other hand.
A cotton ball.
Okay. Basically, what you're wanting to do, you're checking to see about the familiarity. Can they identify with this, with what this object is? This is very pertinent in the examination. Also, you're wanting to check on points, a 2-point direction. I'm going to have you close your eyes. Okay, now, tell me. I'm going to use these 2 objects, have them in a different direction, and what you're wanting to do is see how soon it will be before she detects it's one. Do you feel 1 or 2?
1.
Okay. Well, for Mom, that would be equal right there. Most of the time with people, and it varies, you may open your eyes, when you're touching a person, for example, I'm going to have her eyes open. When I'm touching, she might feel that as 2 objects. Then she might feel of it as 1. Some people, 2, then they might say 1. What you're doing is you're checking on their neurological system how long they differentiate between that being the 2 objects feeling as 1, whereas they are actually 2 objects. Okay, another thing I want you to do, close your eyes again. I'm going to use a sharp object and I'm going to use a soft object. Now I'm going to touch you on your arms and you just tell me if it's soft or if it's hard.
Hard. Soft. Hard. Soft.
Okay. Alright, you may open your eyes. Okay, now we're going to get to deep tendon. But before I begin with that, I do want to state this. Like I stated with the posture and everything, you want to see with the posture how they stand. Do they stand? Do they sway a little bit? when they're walking, do they have a limp or anything like that that goes on? Always remember, those are good cues. Now, with the tendons and everything, unfortunately, I don't have a reflex hammer like I would like, but this would do pretty nicely. So what I'm going to do with the bicep, I'm going to kind of hold the bicep down, and what you do is when you feel the bicep, when you kind of tap that, this will extend. Your biceps will extend. You'll get an extension from it. When you're doing the triceps, you have the arm about a 90 degree, and I'm holding it. When I tap, guess what? I get an extension and everything. Get an extension from the triceps. You can feel it down the arms, or excuse me, an extension of the forearm. Excuse me on that. I know everybody remembers about the patellar, where you got them kind of dangling off of there, and you tap the patellar, you get the extension. Most of the reactions is an extension. I do want to show you this on the foot. Basically, when you do the foot, if you're doing an examination, you're going from the lateral all the way around on the side. What happens is you should see plantar flexion. You should not see a Babinski reflux, which is severe dorsiflexion. This would indicate a neurological problem. So basically, I can tell Mom does not have a Babinski. One more thing that I did not add was the Achilles tendon, in which you're holding the Achilles and using the reflex hammer, and you get an extension there. Continuing on with the musculoskeletal, basically what we're looking at, I've already done, like I said, the TMJ, but what we're going to be doing, we've already kind of done the shoulders a little bit, but what I'm going to have Mom to do is I'm going to have her flex her arm forward, okay, and then flex back. Okay, another thing I want to add, when you're doing this, when you're doing the passive range of motion where you assist, you're going to have about like a increase in the angle compared to the active range of motion. I believe they said it's about a 50-degree angle increase, if I'm correct, but basically don't fret if you see that that's going to be happening. Okay, excuse me, with the fingers, let's just go continue with the fingers and the wrist. I'm going to have you to perform what I would call range of motion and side by side, okay, with the fist, make a fist. And another thing, when you're doing this, I know it can be difficult at times. Feel the joints. Feel to see if there's anything going on. Okay. Now I want you to touch your fingers with your thumb. Okay. And for the sake of time, I'm going to do just one extremity. I'm feeling the joints because to make sure there's no nodules, no masses, anything like that. Another thing you want to do, I want you to do this. This is a neurological step. I almost forgot about that. Alright, we've done the fingers, we've done the toes. A most difficult thing, I'm going to have you to lie down further back where your feet can touch the end of this bed. We're going to be assessing the hip. Okay, now the hip, I can vouch for this, I've had this happen. Excuse me, what we're going to do is, I'm going to have you bend with the knee. You can also do this with the knee, but I'm going to have you cross your legs like so. And what you're going to be doing, you're going to be checking the rotation of the hip, how the hip turns and stuff. What I'm going to have you do, if you can lie on your stomach, and I'm going to have you raise your leg up, okay. You're also checking flexibility, bending the knee back, and checking also on the knee. Okay, you can be lying back down on your back. And while you're doing this, always feel like the joints, like the toes. I'm assessing to see the digits, the phalanges, the metatarsals. Is there any deformity? Are there any swelling and everything? And I'm going to have you also do like you did your fingers. Move your toes, your heel back and forth and side to side. Okay, and that is pretty well normal on that. Okay, I'm going to have you sit up for me one more time. I believe, if I'm correct, that will conclude everything. We've gone through the shoulders, the elbow pretty well. What you're wanting to do, you're wanting to flex it like you would. Let's see, by flexing it and go back. Okay. Another thing, oh, almost forgot. I want you to stand up. And this is more like a realistic thing. A lot of times on the videos, many times you'll see it where they go like this. Sometimes you'll have an off day where you'll think, oh, I forgot this, and I've done that before with the patient. Basically what you're wanting to do, you're wanting to check also the hips. So I want you to do is, we're checking the spine. I need to feel the spine, and the spine feels normal. I want you stationary to your hip. I want you to bend down to try to touch your toes. And while she's doing that, I'm feeling of her back. Okay, to see. Because what you want to check on is scoliosis or lordosis. You want to see, is there any curvation in that spine. Okay, now, I want you to also, okay, I want you to sway on your side and hyperextend back. Okay, you're checking the rotation. You're checking to see how it works and everything. Is everything working like it should? If a person is questioning it, just tell them more or less you're doing aerobics and everything. That kind of would help them out, basically. Another thing I will say with the elbow, what you want to do with the elbow is put your arm back around your hip. What you're doing is you're assessing to see if the elbow, how the rotation is. Now, put your arm like you would be if you're resting. Okay, I'm checking the shoulder, I'm checking the elbow, checking to make sure. And this pretty well is a good assessment tool, like I said, for your musculoskeletal system. And that is pretty well the end of this session. Thank you very much.